intuition, looking at a person's face, you can kind of see just by the shape of their skull. Some people have like kind of pinched heads like on the top, or they have like the bean shape in the middle, how it kind of sinks in the middle. So that would be like the middle cavity needs to be popped out. Some people have like sunken cheekbones, so that's like the lower one, because each chamber corresponds to a different part of your skull. So it's working on an aesthetic level too. I've seen people where we took pictures all 3 days, and you can see their face actually transform because it's moving the bones of your face. If your nose is really crooked or off center, it can move that. Most people's, one eye is more contracted than the other.
Yeah.
So some people will do this instead of plastic surgery because it's moving the bones.
Oh, okay.
Not just superficially, it's more on a deeper level.
So there's this angle. I used to go to get it's called biodynamic craniosacral therapy, which is of course a little bit different, but they also work on your cranium, on your skull, and I remember I was fascinated by it because this woman that was touching my body, she could tell me all my injuries. She would tell me how I was born by just like my shape of my head or touching my head. She'd be like, "Oh, you were born naturally." There was no like epidural or other drugs involved, or she would tell me that I fell on my back when I was a teenager, and I would remember that I did I fell off the tree, and she told me that throughout the life we take injuries and our body adapts to that, including the skull, right? So it's like it has to compensate for something, for some kind of an injury, and there are ways to realign that, right? So I feel like one of the things that you're doing are probably like helping the body to kind of come back to its like optimal way of functioning.
Yeah, that's the goal.
Yeah.
Because most of your nervous system and your nerves are, the shoulders and above. So even if a person has like a problem with an organ down here, it could be because the nerve that runs to that organ is blocked. And so the brain controls everything in the body. So even though like your liver isn't working, it could actually be caused by a head injury, because the brain is what regulates your autonomic nervous system, tells your stomach to produce stomach acid, your liver to produce X, Y, and Z hormone. But if you got hit in the head and that signaling is not happening, it's cut off somewhere, then it could manifest somewhere else. And people think, oh, I have a problem here, but like it really could be up here, or most likely it's up here. That's why people, after they have like a concussion or a car accident, they get food allergies because they're not producing the right acids in their stomach.
Yeah.
Because it starts up here. Your brain is telling your stomach what to do. So this is really important, your brain. And it's really sensitive and delicate. Like people think you need to be like hit hard in the face or the head, or be a football player or a UFC fighter to have brain damage, but like just bumping your head on a door, or even just shaking your head back and forth really hard, the brain can bounce around inside the skull. And then even with childbirth, like a lot of kids have brain damage because women's pelvises are so narrow now that their pelvises aren't big enough for the baby's head to fit out the pelvis, and so it gets pinched on the way out. And so even if you like didn't have any obvious trauma, just being born, because women's bodies, from all the mineral deficiencies in the food, their hips aren't fully developing. So yeah, your brain is important.
Yeah.
Yeah.
Yeah, for sure. But